Clinical Psychology Masters is a 2-year master's program that Krea University has established. In today's unpredictable world, the importance of well-trained mental health professionals and researchers is self-evident. So we invite psychology graduates from across India to come and receive training at Krea in this new exciting master's program.
So today, mental health is a burning issue in our society, and we think that the MSc in clinical psychology is one way to respond to this issue. There are many students who are studying in undergraduate psychology programs, but at the master's level, at the postgraduate level, the programs are far and few in between. So the master's in clinical psychology is one way to bridge the gap. We believe that clinical psychologists need to understand the ethics of their profession and to be self-reflective practitioners, and the MSc in clinical psychology will prepare them for that. We believe that mental health should extend beyond the hospital setting or the private clinic and involve not only individuals but families and communities, and our students will be getting exposure to community models and systemic models of mental health work.
This is a program that's structured on 3 important components of any strong academic program, which is theory, research, and practice. And as all of us know, clinical psychology is grounded so much in practice. So the foundations of this program embeds itself very strongly between research and theory and practice. That students get hands-on experience in terms of not only the theoretical foundations and also being able to conduct research, but also being on ground, able to understand what goes on beyond the classroom.
So our program will be giving the theoretical background for clinical psychologists to practice. They will be doing a clinical internship which will span 480 hours during the course of the master's, and they will be doing a research thesis in their second year.
At Krea, we have a trimester system versus the semester system, which means that one academic year basically has 3 trimesters, which is 12 weeks per trimester, where the students are able to get the breadth and depth of the wide variety of subjects that can be offered in a trimester system. Students will be able to enroll for 4 to 5 courses per trimester, offering them more number of courses in an academic year and also exposure to more number of courses.
We have a very well organized and as well as spacious lab at Krea. In fact, we have 2 of them, one for behavioral experiments and another one for neuroimaging as well as eye tracking experiments that you can do. We have 64-channel net station EEG machine. We have like a Tobii eye tracker. We have also portable EEG machines like Emotive, and we have an FNIRS, that is functional near infrared spectroscopy machine, and quite a few other qualified experienced trainers who can train you in all of these different kinds of methods.
The kind of clinical exposure and training that we emphasize at Krea primarily revolves around internships and practicum at different sites such as hospitals, private mental health clinics that specialize in geriatric and childcare services, to suicide prevention units, as well as mental health rights advocacy work as well. Our primary aim is to train the student in different modalities of therapeutic work, and as most clinicians learn, their practice becomes integrated, but we want to provide that kind of exposure through case seminars, through clinical discussions. our students can grasp specificities of somebody who's presenting with depression and how their presentation might look different. We want to encourage reflexivity in the clinicians. We want to prepare clinicians who are not only facilitating self-understanding, in their clients and patients, but also looking and curious about their own process. So for instance, when I'm working with somebody with depression, why am I reacting differently, and what happens to me? Like, what are the parts where I get bored, for instance, or I don't feel like engaging? So these are the spaces where I think our training will facilitate through careful supervision, discussions, but also preparing self-reflexive clinicians who can sit with their discomfort, tolerate the kind of relational difficulties and challenges that arise in this relationship.
In a fully residential campus, I think the most important aspect is the community that you are building as students. And I think peer learning is the most important aspect. Here on campus, we have students who are, initiating various community initiatives outside of class hours and class timings. Be it arts and cultures, be it theatre, dance, or sports. So I think those are the spaces where students are able to, build friendships and community, which is really important for students generally in life, but also for their well-being. We have support mechanisms in place. Of course, the experience that we want our students to have centers students in student well-being and growth. And our idea is that, students are the ones leading initiatives on campus. Of course, there are various support mechanisms that are available. So the Office of Student Life leads all extracurricular activities, events on campus. We have an inclusive learning support office that is there to support students' academic needs and accommodations. We also have an Office of Residence Life, which addresses, concerns that are arising in the residence halls. We're also running, when I say student-centric, we're also running a residence assistantship program where it is students who are, who go through a selection process.
The Masters in Clinical Psychology program prepares our students to work in a range of different settings. For instance, they can work as rehabilitation psychologists in working with disability and providing occupational therapy. Secondly, they can work as school counselors, in educational counselors, basically in school and college systems. Third, they can work as, in corporate settings, providing advice on wellness and mental health related issues. Third, I think they can also work with, let's say, in capacity of research to study mental health phenomena. And there are several organizations that prioritize working in the field of mental health.
The requirements and eligibility criteria for this program is a 4-year undergraduate program of BA Honors or BSc Honors in psychology. At the most are people who can directly apply. But students who have done their 3-year undergraduate with a 1-year diploma courses, postgraduate diploma or 1-year master's program are also eligible to apply for this course.
Are you interested in clinical psychology? Well, if you are, we would welcome you at Krea University. You would be a good match for this program if you're self-motivated, are interested in original and critical thinking, and are interested in both the intellectual and the professional dimensions of this program.